It's Krista. Welcome back to Made to Be Whole. Stay tuned for this week's exciting update on plasmapheresis.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Welcome back to the show, and thanks for tuning in. I have talked a lot about plasmapheresis, aka Therapeutic Plasma Exchange, which has been in the works to come to our clinic. We're here live, and the preliminary phases will be opening it up on a limited basis to patients next month, and then add additional days as the months go on. I have some really exciting news about how it's affected me personally, since I've been one of the first people to receive it as we work on our training and getting our processes down really smoothly. So a little bit of an overview. Plasmapheresis is also known as apheresis. Those two words can be used interchangeably, and they are a broad umbrella term. The type of plasmapheresis or apheresis that we perform at AHP is called Therapeutic Plasma Exchange, or TPE. And I will throw a few pictures in the show notes so that you can have a better visual for the procedure and what happens. So the way that it's performed is you have an IV in each arm. There are different ways to do it, but typically it's a peripheral IV in each arm. And one of them, blood is being pulled out of you. Then you've got all these tubes in a machine where your blood's processed. There's a centrifuge that spins it really fast. The plasma gets separated and pulled off. The plasma gets wasted. It's going to get thrown away. And the whole blood is returned to your body through the other IV. And it's mixed with albumin, which is a type of protein, to replace the volume of plasma that is lost. So we're doing a 1-for-1 exchange fluid-wise, so your volume in your blood isn't going to change at all. The things that this can be beneficial for are autoimmune diseases, great evidence for reducing those antibody levels. Chronic infections, we're seeing things about babesiosis, about the removal of biofilms, for clearing toxins. Now, outside of the world of AHP, TPE, or Therapeutic Plasma Exchange, is typically done in two settings. And like everything else, we're in no man's land. On the one hand, you have your wellness space. You've got your Joe Rogan, your people who are going and they're doing this for longevity. And it's got great applications for that. I mean, it's an awesome preventative thing that even if you don't have chronic health problems, this would be a great way to do this periodically to help keep you that way. But that's not my practice. On the other hand, you have plasmapheresis or TPE being done in hospitals and especially in ICUs. When people are septic, it's an appropriate intervention. When people have sudden onset symptoms, they're trying to figure out what's going on. They've got these systemic symptoms. They're like, okay, let's take out the trash. That's the way I look at TPE, is it's helping your body take out the trash. Well, AHP lies in the middle. We're happy to help people with wellness and prevention things, but a lot of our patients are already sick. They're not in the ICU, but I want to keep them out of there. And the reason I bring this distinction up is your baseline health is going to impact the way you feel after the procedure. So if you are a super healthy person, you can get a treatment and you might just immediately feel better. One of the nurses who was doing our training said she had one patient who afterwards told her, I feel like running a marathon, like, let's go. And it would be so awesome if it was that way for everyone. But I want people to have realistic expectations. If you are a chronically ill patient, this procedure which is amazing and can be a real turning point in your treatment. It can improve your immune system, like so many good things. It is going to be like other effective treatments in that you might feel a little worse before you feel better. Let me explain a little why. In the context of vector-borne infections, which we talk a lot about on the show and a lot at our clinic, so that would be things like Lyme disease, which is also known as borreliosis, bartonellosis, babesiosis, all of those infections. So think about other treatments for those infections. When you start an effective treatment, every once in a while you're lucky and you just start to feel better. Unfortunately, though, with a chronic infection, very frequently people feel worse before they feel better. It's called a die-off or Herxheimer reaction. A lot of times it's just shortened to a Herx. So one may ask, why, if you're doing this treatment that's actually taking the bad stuff out, am I going to feel worse? Well, there's a couple of mechanisms that are occurring there. So one of them is because your immune system is a little suppressed by the procedure, but then starts to work better because you're taking out the toxins. Like there's less competing stuff dragging down the function of your immune system. You know, if you're getting rid of toxins, if the autoimmunity shuts down, all of that, all of a sudden your immune system is going to be in a better position to go after these illnesses, and you're going to have an increased therapeutic response to what you're already doing. So I'm going to tell you a little bit about how it affected me and the days leading up to my first procedure, because I think this is really important. So I have had vector-borne infections, I believe, for over 30 years. I don't know the start date, but when I go back to when symptoms began that correlate with what I'm dealing with now, it was my senior year in high school. So I guess that's actually 35 years ago. I'm a little older than I like to think sometimes. So that's my suspicion. So that's a lot of years of infection and inflammation and other things that my body's clearing. So I figured this out about 4 years ago. So I've been treating that whole time. There are definitely things that have improved, particularly with mental health, anxiety, the pain and knots down the right side of my body that used to be just like unbearable. Those things have all improved. But then other things have popped up and some things have gotten worse. And the last couple of months have been progressively worse. And it had progressed to the point that the week or so before my treatment, I was making it through the day at work and just barely, and I came home and collapsed. I didn't always eat with my family. I couldn't hold myself up. I had severe pain. I had severe weakness. I had, instead of just my regular big heating pad, I borrowed my son's too. I've got them on different parts of my body. And it was simply unbearable. And if I didn't have that procedure to look forward to, I don't know what I would have done. And one could ask, because it's a great question, what happened that things got worse? If you were treating, why did things get worse? Well, I am a spiritual person, and this for me has been a spiritual journey, and God has been with me through it all. And I really had the sense afterwards when I pondered on why did things get so severe. I felt like he was kind of drawing back the curtain, withholding some of the help he had been giving me to get through, to help me understand how sick I was and how much he's been doing for me so that I could keep going and take care of my family and take care of my patients. I was kind of left with a picture or a vision of what condition I was really in. So it was so bad that the morning we were supposed to go for our first training, we had had the machine delivered and calibrated. I was so sick I couldn't get out of bed. I was nauseous. I was dizzy. The pain was absolutely unbearable. Things weren't working. I called my husband because I couldn't even problem solve enough to how I was going to get to the bathroom to get the nausea medicine to try to calm things down. So he called my son, who got the medicine for me. And so it was a miracle just getting to that day of training. So that just gives you kind of a vision of what has happened. So I got the first treatment. It takes a couple of hours. The time depends on a lot of things, the condition of your veins, whether or not you have clotting issues, your anatomy, everything's a little different. So it can go pretty quickly once you're hooked up, even maybe 90 minutes, but it could be 3 hours. So there's a bit of a window there. But even during the procedure, I felt things changing on the left side of my head, which is what I would always feel during procaine infusions too. So I have a lot of inflammation and really, really rough pain on the left side of my head and face and neck. And I could feel those reducing even during the treatment. I felt like stuff was being pulled out of me. I felt a little better. I was able to get through the next few days. I had a rough weekend. I started to have some die-off type stuff, but then things started to get a little better. The next week I did my second treatment. Wasn't difficult at all during the treatment, but then a few days after, it was bad enough that I had to call off work, which I do not like to reschedule my patients, but I could tell what was happening. I tell there were pressure changes in my brain. So in addition to the infections, I do have autoimmune encephalitis. So there is literal inflammation, and I can always feel those pressure changes. But I woke up Friday, I was dizzy, I was nauseous, my head hurt. Like I knew things were shifting, and I knew I just wasn't stable enough to be in the office with patients. So that was a rough day. Saturday was a pretty good day. I was able to do a lot. Sunday was a rough day, but then after that, I feel like the old Krista. I feel like the one that's got energy and ideas and can take things on and is there for people. I wanted to go through head to toe some of the things that I've seen improvements with. Now, I do want to point out before I get to my list that I really don't think it's a situation of, oh, if I would have just done this 4 years ago, I could have avoided these last 4 years. I believe part of the reason the procedure has been so successful, and I'm still planning on doing a few more, is because of everything else I have been doing. Like my IV access was good, which is hard for this procedure sometimes because I've done all this anti-inflammatory stuff and I've been doing IV procaine, and so there wasn't as much vascular inflammation. I had done treatment. I had cleared all this other stuff away. So I think it put me in a better position to receive more significant benefits. And I'm not going to tell you that like everything is super easy. I still have to take stuff when I first wake up in the morning so that the stiffness calms down so that I can get out of bed. I still have to get in the sauna so that I can move. But it's so much better. This I can live with, but I have hope that it's going to continue to improve. So things that have improved for me in the 2 weeks since I had started my treatments: more stamina for sure, kind of head to toe, much less head pain, much less. I have very mild sense on this left side of my head that there is a little more inflammation there, but I no longer feel the pulling and the pain like in the bones of the left side of my face and my jaw. My left neck is still a little more stiff and feels a little different, but it doesn't feel like it's being squeezed anymore, and that's a lot easier to move. I've had less pressure in my ears, which has led to better hearing because my hearing is still impaired, but the inflammation, it's just been muffled, and there's been nothing else that's helped other than procaine, which works for a while, but then it wears off. Less shoulder pain, less GI bloating and pain. My insides feel cleaner. I know that sounds a little funny, but they just feel cleaner, and it's actually been easier to eat super clean because it actually makes a difference. Before things were so bad, you're being as disciplined as you can and you're still in misery. It almost wasn't worth it, but I crave clean stuff now because it's just easier to get down. More normal bowel movements, no more like bowel urgency, frequency, fewer loose stools, less bladder urgency, which is nice. Less, I had this really weird pain in my left kind of like pelvis and the pubic bone there just on the left. I haven't had that. I've still had stomach stuff because, again, don't look at the world through lime-colored glasses. There's a lot of things that can happen to our bodies, and you're not getting out of this life without something. I haven't had leg swelling and throbbing. My legs feel less heavy. It's been a really, really good, really, really hopeful thing. And that has come to pass within 2 weeks of me creating Krista's new pain scale. So this is how bad the pain was, just as a reference point, okay? So we've heard, the psalmist says, "Yea, though I walk through the valley of shadow of death." So I have a 1 through 6 pain scale based on that. Number 1 is I walk through the valley of the shadow of death. 2 is I stagger through the valley of the shadow of death. 3 is I crawl through the valley of the shadow of death. 4 is I languish in the valley of the shadow of death. 5 is I lay writhing on hot, jagged rocks on the floor of the valley of the shadow of death. And 6 is I plead for the scepter of death. So those were the sorts of things that were going through my mind at that point when things were at that worst. And now, I went from a 5 to a 6 on my scale to a 1 or 2, maybe a 3 on bad days. But I'm just really, really optimistic because I've done so many things, so has my family, and so have so many of my patients. You've worked so hard for so long and been so disciplined, and things are still harder than they should be. You still are working too hard to feel this bad. I know a lot of you fall into that camp, and I'm quite sure, even though this procedure is not inexpensive, it's an expensive machine, expensive supplies, a complex medical procedure. It's not cheap, but I'm convinced that in the long run, I will make that back and more with increased productivity and fewer supplements and medications. I've already been able to peel back my supplement list because there were a lot of things I was taking just to survive that I've been able to say, I need certain nutrients still, I need certain things for treatment, but I don't need the volume that I did because my body isn't carrying such a heavy, heavy burden. So a few questions that we've had, is this procedure safe? Yes, it is safe. Now, everything has risks, right? Absolutely everything. But if you look at what's actually happening, even though it's complex and can look a little scary, intimidating because you've got 2 tubes and you're looking at your blood going through a machine, you have to remember, first of all, what's being put back in you is your red blood cells plus albumin, which is a human protein that's like ultra processed and purified. Okay. So there's no volume loss. So why that's important, if somebody loses a lot of blood volume, that can put you in shock. That can cause low blood pressure. That can cause a lot of other issues. There's no volume loss. Very, very, very rare to have a reaction to albumin, but we watch you closely. If you have a reaction, it's usually within the first 15 minutes. So we would stop the procedure, make adjustments. There are other things you can use besides albumin for a replacement fluid, it's called. But I really, really like albumin, and it also does some really great things for keeping fluids in the blood vessels, which can help reduce edema. It does some really, really cool things. It's kind of my replacement fluid of choice. That's what we're going to use. And it is pretty standard. And thankfully, one of the hard things is supply. We found a pharmacy that's willing to be basically our supply coordinator and keep us in stock with the ordering. So we're super, super grateful for that. The other things that go in your body as part of this procedure, there's a very low level of what's called ACD that goes into the blood. ACD is an anticoagulant. So anti means against, coagulation means clotting. So obviously we don't want your blood to come out of your body and then clot up and put that back in you or have trouble getting that back in you. So there's a small amount of ACD that goes in your body. Most people do well with that. Again, we just watch you really closely. We've got to adjust the rate. That's one of the other reasons why we might speed up or slow down. If somebody's doing super great and feels fine and their veins are doing fantastic, we can speed it up. If they're feeling a little funny because of what's going on, then we can slow it down. You also have saline, which is not a big deal. There's some saline that's part of the procedure. Most of it's being used just to flush the lines, but that's part of it. We might use a tiny, tiny bit of what's called heparin in your IV line, but that's just to keep the line from clotting. Now, this procedure does deplete your calcium, and there's a couple of different ways to do that. It's not at a super, super high level that it's depleting it, but we're going to make sure beforehand that you don't have low calcium to start. We do oral calcium before and during the procedure. And what we use for that is just Tums, because that's calcium, it's chewable, it's easy to do. The reason we might do it more frequently is if you say, oh, I've got a little tingling around my lips or a little tingling in my fingers. That can be low calcium. So we might say, do another Tums. There's also the ability to do calcium through the IVs as part of the reinfusion, and that might be something we add in the future. Other medications that might be used depending on your situation. If you're somebody who's super, super anxious, we could do Benadryl or IV Benadryl, oral or IV, before the procedure just to help your body relax and calm you down. If you're somebody who's really nauseous, we could do some Zofran, things to mitigate that. But on the whole, when you're looking at risk, we are not putting a whole lot of weird stuff in your body, and the stuff we are putting in has very, very low risk, okay? Probably the biggest risk with the procedure, when we have people sign consents, like what could happen? You have to use pretty big needles for these IVs because your blood is thicker, right? Blood's thicker than water in more ways than one. And so you can't use a super tiny needle because you're not going to be able to get the blood out. So those can be a little uncomfortable. I think a lot of that has to do with also your body's anatomy and other things. These are steel needles that are 17 gauge. I found them less painful than even starting the regular IV. I don't know if it's just because they were really sharp. I don't know. I didn't have an issue with them, but if you're someone who is really sensitive to touch, or they maybe have to go a little deeper with your veins, then that might be a bigger issue. There's a lot of coordination that has to go on at the beginning of the procedure because it takes a while for us to set up and prime the machine and the kit and the pump. And then we've got to get your IVs going at the same time. And you want to coordinate things. So there's a little bit of back and forth and time that goes with that. We can apply, if you're somebody who really, really, really struggles with needles, pain, that sort of thing, in addition to something like Benadryl pre-procedure, we can put lidocaine cream on your arms, the places that we're going to place the IV, so that there is so that it's numb. We can also run fluids before the procedure, to help if you are someone who tends to get dehydrated. Let's make sure, we want you to drink a lot the days before, but we can also say, you know what, let's run a bag of fluids beforehand to make sure the volume's good and this person feels their best. Or we can do fluids afterwards. Sometimes we'll run a Myers cocktail or Nutrient IV afterwards. So there are a lot of ways to mitigate this. Your first procedure is probably going to take the longest because for the majority of people, there's a little bit of troubleshooting going on, figuring out your body and your body's response. Of course, there's some people who get lucky. Oh, they've got great veins. We get them both the first time. They don't have a flow problem. They're not anxious. Everything goes great. But we found so far that because individuals are so different, the first procedure is probably going to take longer as we finesse the procedure. We've also noticed that things that make the procedure better tolerated are hydration, eating before the procedure. You do not want to do this on an empty stomach. So even if you're coming in the morning, eating breakfast, especially a high protein breakfast, can help you have good outcomes. So we really, really, really recommend that. We've had some varied responses so far in other family members who have had it, but if you have ever had a really negative reaction to a blood draw, So my daughter is an example of this, and this is why I wouldn't do TPE on her unless we had a port or something else placed, is when you do blood draws, she has what's called a vagal reaction. So sometimes she'll pass out or she'll jerk. Like the nervous system completely overreacts, even though there's not a lot of anxiety about the procedure. She has this vagal response. It's happened to my husband and other people in the family. So some people we just know based on history, why don't we do some other things ahead of time to increase your chances for success with this procedure? So there's a lot that we can do to personalize it and make it a great experience. In our next episode, I'm going to talk about the things we can do for what's called vascular access if IVs are tricky for you. That can help set us up for success. We've had some good experiences getting alternative lines in, have learned some things about the insurance system to help maximize, not necessarily paying for TPE because most insurances won't, but maximize coverage for IV therapy and some line placements and all of that. So we're learning as we go. If you have tips, things you've learned from other experiences, we'd be happy to hear them so we can make this a fantastic experience for our patients and support you on your road to healing. It's a process. It takes time, but this can be a piece in your puzzle that can really reduce inflammation, benefit the immune system, and mechanically remove things from your body that are impeding healing. That makes a lot of sense to me. And I think it might actually be the antidote to modern living. I've thought a lot, the more I've practiced over the years, of how do we deal with this world where there literally are toxins everywhere in our food supply, in our air, in our soil. And it's not to be an alarmist or be paranoid. It's just a fact. People are sicker and we're exposed to more stuff all the time. But if one was in a financial position to do so, having a TPE treatment once a year might be one of the best things that you can do, not just to get well, but to stay well and to not let our environment be the enemy. Stay tuned for a discussion on IV access. Reach out to the clinic if you have questions, and remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.